The nursing shift started like any other Tuesday morning at Metropolitan General Hospital. The dawn light hadn't even broken through the skyline yet when the emergency department staff arrived for their shift change. Sarah moved through the hallways with practiced efficiency, her blue scrubs fitting like a second skin after months of wearing them. She worked the medical surgical floor now, assigned to post-op recovery and chronic care patients. The work was fine, technically proficient. She could manage any patient, handle any complication, respond to any crisis with a kind of unshakable calm that only came from years of intense medical training. But it wasn't what she was meant to do, and everyone knew it. The hospital knew it. The nurses knew it. Most importantly, she knew it. The trauma department was 2 floors down. She could hear it sometimes through the hospital's overhead system. The controlled chaos of critical care, the coded announcements, the urgency that made her heart rate spike in ways she couldn't quite explain to anyone else. When patients crashed on her floor, she was there. She knew exactly what to do. She'd walked a young post-operative patient through a sudden arrhythmia event last month with such composed expertise that one of the cardiologists had quietly asked her where she'd trained. She'd evaded the question with a smile and changed the subject. That was her way now. Stay invisible, do good work, don't ask for anything, don't draw attention, don't let them look too closely. The head nurse of the trauma department was Patricia Marsh. Patricia had been running that unit for 7 years with an iron fist and a territorial intensity that bordered on pathological. She was brilliant. No one could deny that. She knew emergency medicine inside and out. She had good instincts, strong technical skills, and a commanding presence that somehow communicated both competence and danger. But she was also a bully. That was the word everyone whispered in break rooms and supply closets. Patricia bullied her staff, patronized her physicians, and seemed to view anyone with potential as a threat rather than an asset. She had crushed nurses before, sidelined physicians who challenged her, made herself the undisputed authority in her domain through a combination of technical excellence and emotional brutality. Sarah had made the mistake of correcting her 3 months ago. It was during a trauma code, a motor vehicle accident victim with a pneumothorax and possible cardiac tamponade. The patient was crashing, bleeding out, and the minutes mattered in ways that only people trained in emergency medicine truly understood. Patricia had called for a chest tube, asserting her authority with the kind of confidence that made people follow orders even when they weren't sure. But the patient needed a pericardiocentesis first. The tamponade was the immediate threat. The fluid compressing the heart needed to be drained before they did anything else. Sarah, who had been cross-training in trauma at the time and was present in the bay, had said quietly, "We should aspirate first." Not as a command, not with attitude, just as a clinical observation, a gentle correction, a suggestion from someone with real knowledge about what was actually happening. Patricia's face had gone red. She'd said loud enough for everyone to hear in front of the residents and medical students and the other nurses. "I'll take my medical guidance from the physicians, not from a med-surg nurse playing dress-up in my department." The word dress-up had hung in the air like a slap. It wasn't just a rejection of Sarah's clinical input. It was a public humiliation designed to establish dominance and power. The physician had agreed with Sarah anyway. That was the worst part from Patricia's perspective. The patient had gotten the needle aspiration, and it had drained 200 milliliters of blood that was compressing the heart. The patient had lived because Sarah had been right. And Patricia had never forgotten it. More than that, Patricia had understood what it meant. That Sarah had training and knowledge that went deeper than her official credentials suggested. That Sarah was capable of seeing things in trauma situations that most nurses were not, that Sarah could eventually become a threat to Patricia's authority if she wasn't managed properly. 2 weeks later, Sarah's schedule changed. She was removed from the trauma rotation. Patricia had gone to the chief of nursing and raised concerns about her experience level and her lack of focus on her primary assignment. She'd made vague comments about unprofessional behavior and questioning medical decisions. The chief of nursing, who didn't want to deal with Patricia's legendary wrath and whose medical knowledge was limited compared to Patricia's, had approved the transfer immediately. Sarah was reassigned to medical surgical care, the assignment that essentially meant she was no longer on the trauma track. Patricia had pulled her aside in a hallway afterward and said words that had burned into her memory. "You don't have what it takes for trauma. You'd be better suited to quieter work. Trust me, I'm doing you a favor. You don't belong there." There had been something in Patricia's voice that wasn't just professional assessment. There was cruelty in it. Satisfaction. The satisfaction of someone who had successfully eliminated a potential rival. Sarah had taken the transfer without protest, without anger, without explanation to anyone. She just accepted it and moved to her new assignment. Some of the other nurses probably felt sorry for her. Others probably agreed with Patricia's assessment. Sarah had learned long ago that people's opinions of you mattered far less than the work you actually did and the skills you actually possessed. She could work med-surg better than anyone on that unit. She could prevent complications, recognize deterioration, and handle emergencies with a kind of instinctive competence that puzzled even the most experienced physicians who worked with her. But she did it quietly. She didn't volunteer for extra trauma assignments. She didn't fight Patricia's assessment. She didn't speak up about the injustice or appeal the decision. She just worked. And when she ate lunch, she ate alone. And when her shift ended, she changed out of her scrubs and went home to her small apartment. Her apartment was sparse. She kept it that way by design. A bed, a table, a couch. No photographs, no personal items, nothing that told a story about who she'd been before she was a civilian nurse. The walls were bare. The refrigerator contained minimal food. Everything was maintained in a state of careful emptiness, as if she was temporary in her own life. Her arms were usually covered, even in the heat of summer, even when she was alone at home. The tattoos underneath were not something she was ready to explain to anyone. There was the insignia of her unit on her shoulder. There were names on her forearm of soldiers she'd lost. There were dates marking deployments and a silver star insignia on her ribs. There were things written in languages other than English that held meaning only for people who'd been where she'd been. She kept her hair pulled back in the same way most days. She wore minimal makeup. She moved through the world trying to take up as little space as possible, but her body couldn't forget what her mind tried to suppress. When an ambulance siren wailed, her pupils dilated and her breathing changed. When someone touched her unexpectedly, her heart rate spiked in a way that took minutes to normalize. When she heard loud noises, car backfiring, construction, doors slamming, her first instinct was to assess the threat and establish cover. She'd been seeing a therapist at the VA clinic on Thursdays for the past 2 years, working through trauma that she rarely discussed and certainly never mentioned at the hospital. The trauma that came from being a combat medic for 6 years. The trauma that came from holding the hands of dying soldiers whose injuries were beyond saving. The trauma that came from making the choice between triage protocols and the human impulse to save everyone. She'd lost soldiers she was training. She'd watched people die when she was seconds away from being able to help. That was why she'd left. That was why she'd become a civilian nurse, to work in a place where the patients could actually be saved. She hadn't planned to hide it. She'd planned to reinvent herself, to move forward. But the hospital system had been slow to hire her, and on her application, she'd listed her nursing certification and her civilian experience, and left off the military part because it felt easier than explaining it. Once she'd omitted it that first time, it had felt even harder to correct the record. So she'd become someone with a simple background, someone with regular training, someone who was just another nurse. The weeks in the Med-Surg unit stretched into months. She was good at what she did, better than good. But there was no challenge in it. Her body had been trained by the most intense military medicine program in the world. She'd worked in field hospitals under fire. She'd triaged mass casualties when there were more wounded than you had hands to help them. She'd performed procedures that saved lives in seconds because every second mattered. She'd trained with some of the best combat medical personnel in the world, and the training had become part of her muscle memory, her instinct, part of who she was, whether she wanted it to be or not. Post-operative recovery and geriatric care were important. She took them seriously. But the skills she'd been trained to use, the knowledge that lived in her bones, the capabilities that had been forged through years of intense military medical experience, those were sitting dormant while she changed surgical dressings and monitored blood pressure readings. It was like being a concert pianist forced to play only simple scales. She heard about Patricia's management style through the hospital grapevine. How she'd made a resident cry during rounds. How she'd refused to work with a nurse who questioned one of her decisions, demanding the nurse be taken off her unit. How she'd fought with anesthesia about sedation protocols and won through sheer force of personality. Patricia wasn't just running a department. She was establishing a kingdom where everyone else was a subject, and her word was law. There was no room for anyone who might challenge her, who might be smarter than her, who might shine brighter. Sarah didn't hate her. Hate was too complicated. She simply understood what Patricia was, someone insecure enough that she needed to dominate everyone around her, someone brilliant enough to justify that domination with clinical excellence, someone who would never survive if she had to stand next to someone who might shine brighter than her. The Tuesday started ordinarily. Sarah was on a morning shift, charting on a 68-year-old with a hip replacement, documenting his progress. His daughter had visited the day before and had told Sarah that her father was finally smiling again for the first time since the surgery. That he'd been in so much pain before that he couldn't find joy in anything. And now he could think about something besides the pain. It was good work. It mattered. She told herself that regularly. She documented every patient interaction, every small improvement, every moment of human connection that made her job worth doing even when her body was screaming at her to do something different, something more challenging. The hospital was moving through its morning routines. Visitors were starting to arrive. Breakfast trays were being distributed. The cafeteria was beginning its lunch preparations. Life was proceeding normally on this floor, peacefully, without the urgency that existed just 2 floors below. Then, the overhead system changed. The tone shifted. An emergency broadcast came through, not the routine announcements, but the urgent calls for specific departments. Trauma activation. Level 1. Multiple casualties. ETA 2 minutes. The voice was clipped, professional, controlled. The message was repeated 3 times. Level 1. Multiple casualties. 2 minutes. Sarah's body responded before her mind caught up. Her heart rate increased immediately, jumping from resting to combat ready in seconds. Her pupils dilated. Her breathing deepened, and her hands came to rest with their palms open on the desk in front of her. These were the responses of someone trained to prepare for combat. Someone whose nervous system had been conditioned by years of military medical operations to interpret that message as equivalent to incoming fire. She forced herself to breathe. She was not on that team. She was not authorized to be there. She had been explicitly told she didn't belong in trauma, but 2 minutes wasn't enough time to prepare for multiple trauma victims. Multiple casualties meant they'd need every person they could get. The unit where she was working hummed with activity around her, but no one was going anywhere. The Med-Surg team had no role in multiple casualty trauma codes. Sarah stayed at her desk. She kept charting. She made her hands do something productive while her mind ran through differential diagnoses and treatment protocols and tactical medical algorithms that she wasn't supposed to remember anymore. 15 minutes passed. Then 20. The trauma activation remained in effect. She could hear the emergency department even from where she was, 2 floors down. The controlled urgency of a functioning system, but underneath it, something else. Stress, something more than routine. She heard voices raised, heard the code blue announcement. She heard someone say the words that made her stand up. "We need more hands down here." The urgency had become strain. The system was stressed. They were losing control. Sarah could hear it in the quality of the radio traffic, in the tone of the announcements. She heard a crash cart go past in the hallway faster than it should go. Heard an announcement for additional surgical staff. Heard someone say, "I've never seen wounds like that in a civilian setting. What kind of accident was this?" Blast wounds. That's what the speaker was implying. She could picture them. She'd seen them before. She'd treated them before. She knew exactly what wounds looked like when they came from explosives. Blast wounds had characteristics, the burns, the way the tissue separated, the pattern of injury that was completely different from vehicle trauma. Sarah made a decision she knew she would pay for. She logged out of her computer without saving her last entry. She stood. She didn't let herself think about the consequences. She moved to the elevator. She pressed the button for the emergency department and went down 2 floors. The emergency department doors opened to chaos that was just barely controlled. The trauma bay looked like a coordinated dance that was coming apart. There were 6 people working the immediate area around one patient. A young male with catastrophic injuries that made Sarah's assessment process move into overdrive. Her eyes cataloged everything. Compound fracture left leg with significant soft tissue damage. Probable internal bleeding evidenced by abdominal distension. Chest wounds that suggested possible cardiac involvement. Massive loss of blood that had already been transfused and was still flowing. This wasn't a motor vehicle accident. The wounds were too specific, too characteristic of blast trauma. This was a soldier. The Special Forces equipment was scattered around the edge of the trauma bay. Tactical vests, helmets, weapons, medical gear. The team members who weren't working on the primary patient were lined up against the wall, covered in blood, watching with the particular intensity of people who had trained for this, who would follow this patient's treatment to its conclusion. There was a specific kind of silence in that group, the silence of soldiers watching a comrade in crisis. Patricia was present, but she wasn't functioning at her best. Sarah could see it immediately. Patricia was seeing the wounds, but she wasn't reading them correctly. She was calling for procedures that were appropriate for routine trauma, but wrong for blast injuries. She was focused on establishing IV access when the patient needed bleeding control. She was ordered imaging when the patient needed immediate surgical intervention. The patient needed immediate bleeding control. The abdominal distension told Sarah that story immediately. Patricia was still working on establishing more IV access and getting imaging that would take time they didn't have. Time that would kill the patient. Sarah didn't think. Her body moved. She stepped into the trauma bay and went straight to the patient's left side and put her hand on the patient's abdomen, feeling the tension there. The rigid distension that indicated massive internal hemorrhage. The patient's skin was cool and clammy. The compensatory tachycardia was visible in the monitors. She looked at the physician who was nominally leading the code and said, her voice cutting through the chaos with absolute authority, "He's bleeding out internally. Peritoneal signs. He needs the OR now. He doesn't have time for more imaging. Every minute we spend here, he's losing blood into his abdomen." The physician, a young trauma surgeon who Sarah didn't know, looked at her like she'd appeared out of nowhere. Because she had. Patricia's head snapped up, and her face went through a progression of emotions in about half a second. Shock, anger, horror that Sarah was present, fury that Sarah was touching her patient, fury that Sarah was speaking with authority in Patricia's trauma bay. "You," Patricia said. Her voice cut through the trauma bay with the force of a blade. "You need to leave. Now. You are not authorized to be here. This is not your patient. This is not your department. This is a trauma code, and you have no business being present. Security. I need security now." No one moved. The physician was looking at Sarah, and something in her bearing, something in the way she was touching the patient with complete confidence, something in the clinical assessment she'd just offered, was making him reconsider Patricia's assessment. The patient was crashing. Patricia's approach wasn't working. This woman was offering something different, something that sounded right. "He's right," Sarah said. Her voice was level, calm, steady. The voice of someone who had spoken with authority in places where authority meant survival. "The internal hemorrhage is causing tamponade, restricting the patient's cardiac output. The abdomen is too rigid. The patient is in shock. This is a surgical emergency. Every minute we spend in the ED is a minute he's losing blood into his abdomen, a minute his organs are being starved of oxygen." "You don't have the authority to make that call," Patricia said. She was genuinely furious now, her face flushed, her hands shaking slightly. Beneath the fury was something else. Fear. Fear that she'd been wrong. Fear that someone had just challenged her judgment and been right. Fear that she wasn't the smartest person in the room anymore. "I'm making the call," the trauma surgeon said. He was already moving, already giving orders to the team. "Let's get him to the OR now. Massive transfusion protocol. 2 units of O-neg. 2 of AB plasma. Let's go, people. Move." The trauma team moved with the urgency of people who understood that this patient was running out of time. The patient was being moved to the stretcher, being rolled toward the operating suite. The young Special Forces soldiers who'd been watching from the wall were stirring, starting to follow their comrade. But the damage had been done. Patricia had been overruled. Patricia had been wrong. Patricia stepped directly in front of Sarah as the surgical team moved past. Her voice dropped to something more controlled, but somehow more dangerous. The kind of controlled fury that came from complete loss of control. "You have just committed the most insubordinate act of your career. Do you understand what you've done? You have overstepped your authority in front of physicians and staff. You have interfered in a trauma code when you were not authorized to be present. You directly contradicted me. You presented yourself as an authority on blast trauma and blast injuries when you have no official training in that area that I'm aware of. I had you removed from trauma for a reason, because of exactly this kind of recklessness. You don't belong here. You never have. You're unstable and untrustworthy, and you just inserted yourself into someone else's patient without permission or protocol. You violated chain of command. You violated procedure. You violated my authority as the head of this department. You will be reported to hospital administration. You will be written up. You will be terminated and sued if I have anything to say about it. Your nursing career is finished." "Patricia." The voice came from the doorway. It was deep, steady, the voice of someone who was accustomed to being obeyed. It had the weight of military command, the kind of voice that had directed soldiers in combat, that had made decisions that meant life and death, that had earned the right to be listened to. It was attached to a man who had to duck slightly to fit through the trauma bay entrance. Once he was inside, the entire quality of the room changed. He was massive, not just tall but wide, built with the kind of physical density that came from years of carrying weighted gear through difficult terrain. His tactical vest hung open over a compression shirt that was soaked with blood that didn't belong to him. His face was scarred, weathered by sun and wind and time spent in places where comfort wasn't available. One scar ran from his temple to his jaw. His eyes were gray-green, and they looked at Sarah with a recognition that was absolute and terrifying to Patricia. "That's my medic," he said. His voice was level, not angry, not particularly emotional, just stating fact. The room went quiet, completely quiet. Patricia looked at the man like he'd spoken in a language she didn't understand. The other nurses were staring. The doctors were staring. The soldiers in the room straightened, coming to attention despite the chaos. The air in the trauma bay shifted into something else entirely. "You," the man said. He was walking toward Sarah now, moving with a calm certainty that made people step out of his way. "What's your call sign?" Sarah's throat went tight. She hadn't heard that question outside of therapy in 6 years. "Nightingale?" she said quietly. The man, clearly some kind of commander, nodded once. "Captain Sarah Hernandez, combat medic, 3rd Battalion, Operator Support Team. 4 tours in Afghanistan, 2 in Iraq, 17 confirmed save call-outs in theater, 14 secondary casualties prevented through battlefield triage under fire. Silver Star for valor under fire. Purple Heart received twice. Medical qualifications in emergency medicine, trauma surgery, and critical care. You do belong in trauma. You belong in any medical facility, anywhere in the world. And if anyone here has a problem with that, they're going to have a problem with me." Patricia had gone white. Literally white. Her power was being stripped in front of her. "I'm Colonel Marcus Webb," the commander said. His voice carried the weight of his rank and his experience. The way he said his name wasn't boastful. It was factual, a name that meant something to people in certain circles. "You trained half my current team in combat medicine. You trained them under fire in some of the most difficult medical conditions on Earth. You saved 4 of my soldiers' lives in the field in Helmand Province. Soldiers who would be dead or permanently disabled if you hadn't been there, if you hadn't known exactly what to do and how to do it. You have more legitimate combat medical experience than anyone in this hospital. You have more practical trauma experience than most of the trauma surgeons working in this building, and right now, I need you in the OR with my operator. That's not a request. That's a statement of fact about what needs to happen to save his life." His eyes moved to Patricia. They were gray-green and cold, the eyes of someone who had made life and death decisions on a regular basis, who had seen combat, who had lost soldiers and made peace with those losses. "You removed her from this department because of ego, didn't you? Not because she wasn't qualified. Because she was more qualified than you are in certain areas. Because you felt threatened by her competence." "She can't," Patricia started. But her voice was weak now. Everyone could hear the tremor in it. "With respect, ma'am," Colonel Webb said. And his politeness made it somehow more devastating than any anger could have been, because it demonstrated how completely beneath his concern she actually was. "You're not in my chain of command, and neither is she right now. She's a trained military medical professional assisting in the emergency care of a critically wounded United States military casualty. And she's the best qualified person in this building to help save the life of my soldier. Now, I'm going to ask you one time, and I suggest you choose your answer very carefully. Are you going to stand in the way of that? Or are you going to step aside? Patricia didn't move. She couldn't move. She had already lost. She had lost the moment Sarah walked into that trauma bay and assessed the situation correctly. She had lost the moment the trauma surgeon trusted Sarah's judgment over hers. She had lost the moment Colonel Webb walked through that door and looked at Sarah with the kind of recognition that meant they had been through something together that connected them permanently. She understood now that she had been standing in a room with someone far more dangerous than she had realized, far more capable, far more trained. And she had tried to eliminate that person because of insecurity and ego. Sarah moved. She pulled off her civilian scrubs right there, standing in the trauma bay in her undershirt. One of the soldiers immediately pulled a surgical scrub set from the emergency supplies and handed it to her. She changed with the unself-conscious speed of someone who had performed field medicine changes in far worse conditions. Her arms were visible as she pulled the surgical top on. And for the first time in months, her tattoos, the unit insignias, the names of soldiers she'd lost in small, careful script, the deployment markers, were visible to the entire hospital staff. The marks of a combat medic, the marks that proved everything Colonel Webb had just said. "Doctor," Sarah said to the trauma surgeon, "I'm ready. What do you need from me?" The trauma surgeon nodded. He'd already made his decision about who to trust. "Let's go. We need to establish hemostasis control before we address the other injuries. I want you on the bleeding control side. You'll anticipate what needs to happen. You'll know exactly what to do." They moved toward the OR together, moving with purpose. Sarah could feel Patricia's eyes on her back, could feel the moment the head nurse truly understood what had happened. The professional power structure had just inverted completely. Sarah wasn't the person who didn't belong. Sarah was the person who belonged more than anyone else there. Sarah didn't look back. Colonel Webb and his soldiers fell into step beside her as she walked toward the operating suite. One of the younger soldiers said something quietly in Pashto, spoken with the accent of someone who'd spent years in the field. The young soldier had said, "We knew she was out there. We knew you were out there, Nightingale." Sarah pushed through the doors into the operating suite where the wounded operator was being prepped for emergency surgery. The OR nurse looked startled by the influx of soldiers, but the trauma surgeon waved them through with absolute authority. "She's with me," he said. "Her presence, her expertise, her role in this operation." Sarah scrubbed her hands and arms with the precision of someone who had done this in combat conditions with improvised water. She was moving purely on instinct now, on muscle memory, on the years of training that had shaped her into something other than a regular nurse. Her hands moved across the sterile field with perfect confidence. She anticipated what would be needed before it was asked. She saw complications before they developed. She worked with a trauma surgeon like they'd been partnered for years instead of moments, each understanding what the other was thinking without speaking. The bleeding control took 40 minutes of intense, focused work. Sarah moved with the kind of competence that comes from doing something not just a few times, but hundreds of times, thousands of times when lives depended on speed and accuracy. She identified the source of the hemorrhage, a lacerated splenic artery with associated injury to the mesentery. The vascular damage was extensive, the kind of damage that would kill a patient if it wasn't managed perfectly. She guided the surgeon through the visualization and repair with commentary that was clinical and exact, delivered with the confidence of someone who had seen this exact injury in field conditions and knew exactly what needed to happen. Every word she spoke came from her military medical training, from the kind of knowledge that could only be gained through repeated exposure to severe trauma in high-stress conditions. This wasn't textbook knowledge. This was lived experience. This was from working in field hospitals where resources were limited and mistakes were fatal. This was from doing emergency repairs on human bodies in places where the enemy was shooting at you, and the only thing standing between your soldier and death was your training and your hands. When she told the surgeon to move his instrument slightly to the left, he did it without question. He recognized the tone of absolute authority, the kind of authority that comes from expertise that can't be challenged. When she said the bleeder was behind the first layer, he trusted her and found it. When she identified a secondary source of bleeding that the initial assessment had missed, he listened and adjusted his approach. The surgeon had been trained in excellent medical schools. He had experience. But he recognized that he was in the presence of someone whose experience was deeper in this particular area, whose knowledge came from the ultimate teacher. Life or death situations, where hesitation meant death. After 2.5 hours, the operator was stable. The wounds were managed. The internal bleeding was controlled. The threat to his life had been eliminated. The surgeon looked at Sarah across the field and said, "Thank you. I've never worked with anyone with that level of expertise. How long have you been a nurse?" "Civilian?" Sarah said. "About 8 months. Military? 6 years." The surgeon nodded like that explained everything. "You should be in trauma, not wherever they stuck you. This department needs you. This hospital needs you." "I know," Sarah said. "But that's an administration problem, not a medical one." She stripped off her surgical gloves and moved back toward the operating suite exit. Colonel Webb was waiting for her in the hallway, waiting for the outcome. "You could come back," he said. It wasn't a question. It was an offer. With the military, the job market for combat medics is good. Private contracting, medical advising, training operations. You're too good to be wasted in civilian hospitals working under people like that head nurse. Sarah understood the offer. She understood what he was really saying. "I needed to leave," Sarah said. Her voice was steady, but there was something beneath it, something true. "The military was killing me. Not literally, but the weight of it. The constant trauma, the losses, the knowledge that no matter how good you are, sometimes people still die. I woke up at 3 a.m. seeing faces of people I couldn't save. I needed to try being someone who heals without all the violence underneath." Webb nodded. He understood that too. But you can't do it by pretending you're not who you are. You can't hide yourself. The work will always call you back if you try to ignore it. "I know," Sarah said. "And maybe that's the answer. Not pretending, not hiding. Just being honest about what I am and why I can do what I do. Integrating it instead of running from it." Sarah walked back to the med-surg floor where she'd started her shift. The unit was quieter now. The emergency had been managed. She went back to her computer and pulled up her personnel file. Her hands moved across the keyboard with purpose. She drafted an email to the chief of nursing requesting an immediate transfer back to the trauma department. She included a clinical summary of her background, her military medical certifications, a statement that she was fully qualified and available to work at any level of trauma care. She documented everything with the precision of someone making a formal case. She sent the email. 20 minutes later, her phone rang. It was the chief of nursing. The transfer back to trauma had been approved, effective immediately. Patricia would be receiving a formal meeting with hospital administration to discuss her management practices and the appropriateness of her decision to remove qualified staff from critical assignments. Sarah was cleared to begin her trauma rotation again within the hour. Patricia was no longer running the trauma department alone. There would be oversight now. There would be accountability. There would be consequences for bullying qualified staff and making medical decisions based on ego rather than patient care. Sarah changed back into her trauma department scrubs, the darker blue that designated emergency personnel. She put her arms through the sleeves without rolling them to cover her tattoos. Her military service tattoos were visible now, displayed without shame or hesitation. The unit insignia on her shoulder, the names of fallen soldiers on her forearm, small enough to be personal but permanent enough to be unforgettable. The deployment dates marking years of her life spent in places most people would never experience. The silver star insignia marking her recognition for valor. All of it visible now. All of it acknowledged. All of it part of who she was and who she had become. She pulled her hair back into a practical ponytail and headed down to the trauma bay. Other nurses saw her pass in the hallway, and their expressions changed. The confidence she moved with now was different from the quiet competence she'd shown before. This was the confidence of someone who had been tested and had proven herself not just to herself, but to people who mattered. This was the confidence of someone who belonged exactly where they were going. The trauma bay was slightly different than she remembered. There was a new equipment arrangement in one corner. The medications had been reorganized, but the essential space was the same. The place where critical patients came to be saved, or at least to be given their best chance at survival. The place where she belonged. She walked down to the administrative office where the head nurse was packing her personal items into a cardboard box. Patricia's career at Metropolitan General Hospital had effectively ended. The administration had made that clear. The formal transition would take a few weeks, but Patricia's authority was gone. Her power was dissolved. Her time of domination was finished. She kept her eyes down as she packed. She didn't look at Sarah as Sarah walked past. Colonel Webb and 2 of his soldiers were waiting in the trauma bay entrance. Webb had traded his tactical vest for a button-down shirt, but he still carried the presence of command. When he saw Sarah walk in, he nodded once in acknowledgement. "Thank you," he said, "for saving him." "That's what I do," Sarah said. "I know," Webb said, "and I think you finally do too." He left with his soldiers, all of them carrying the specific bearing of military personnel, straight-backed, purposeful, moving with the knowledge that they could handle whatever came next. Sarah watched them go, and then she turned and looked at the trauma bay that had been denied to her for months. The equipment was organized. The stations were ready. The monitors were quiet, waiting for the next emergency. This was where she belonged, not in hiding, not pretending to be someone she wasn't. She had been a combat medic. She had saved lives under fire. She had held people's hands when she couldn't save them. That was part of her story. And the answer wasn't to reject that part of her story or hide from it. The answer was to integrate it, to acknowledge it, to let it inform the kind of nurse she was without letting it define her entire identity or crush her beneath its weight. She was more than a nurse. She was more than a soldier. She was both, and together, those identities made her capable of things that people without either background could barely comprehend. She could see things others couldn't see. She could know things others couldn't know. She could do things others couldn't do. The next morning, Sarah began her trauma rotation. Patricia's shift was scheduled for later that week. When Patricia arrived for her final shift and saw Sarah standing at the nurse station in full trauma rotation status, something in her face broke. The realization that she had made a terrible mistake, the understanding that she had attempted to diminish someone who was actually far more capable than she was. Sarah didn't gloat. She didn't take revenge. She just went about her work with the same competence and calm she'd always shown. She saved lives. She handled crises. She worked with physicians and surgical teams who quickly learned to trust her implicitly because her judgment was superior, her knowledge was deeper, her experience was broader. And Patricia watched from the side as someone she'd tried to remove from the department became clearly, undeniably, the most valuable member of the trauma team. Within 3 weeks, Patricia requested a transfer to a different hospital. Within a month, a memo was distributed about changes to the trauma department's chain of command and oversight structure, with specific emphasis on ensuring that personnel decisions were made based on clinical qualifications rather than personal preference. Sarah continued her work in the trauma department. She continued to wear her scrubs with her tattoos visible. She continued to let people ask questions about her background, and when they did, she answered honestly. She was a combat medic who had served her country with distinction through multiple combat deployments. And she was also a nurse who was dedicated to saving lives in a civilian setting. Both things were true. Both things mattered. The hardest part had been the hiding. The actual work, the medical work, the nursing work, the clinical decision-making had never been hard. It was the pretending that had been exhausting. It was the denial of who she was that had drained her energy and her purpose. Now that she'd stopped hiding, now that she'd accepted both parts of herself, now that she wore her history on her arms where everyone could see it, she felt whole. She still saw her therapist on Thursdays. She still processed the weight of her military service and the losses she had carried. She still woke up sometimes at 3 a.m, remembering faces. But now she was doing it as someone who had integrated her past with her present, who had stopped trying to be two different people, who had chosen to be whole, even if that wholeness included complicated parts of her history. Even if it meant carrying scars, even if it meant remembering. The Special Forces operator she'd helped save in the OR recovered faster than anyone expected. His injuries were severe, but Sarah's interventions had saved his life, had prevented secondary complications, had given him the chance to go home to his family. After he was cleared for medical discharge, he started visiting the hospital's trauma department regularly to volunteer, and he always sought Sarah out. He called her by her military call sign when they talked. He told other soldiers about the nurse who had saved his life, who had operated with the precision and knowledge of someone who'd been trained at the highest levels of military medicine. He made sure that people understood that she was extraordinary, not just as a medical professional, but as a human being who had made the choice to keep going, even when the weight of what she had experienced could have easily crushed her. When the hospital held trauma training sessions or brought in speakers to discuss emergency medical procedures, they always asked Sarah to participate. She became known throughout the institution, not as the person who had been quietly dismissed, but as the person who had quietly demonstrated that she was exceptional and that she had never needed anyone's permission to be excellent at what she did. Residents wanted to work with her. Nurses asked for her advice. Physicians sought her input on complex cases. She had transformed from someone hiding in plain sight to someone respected across the entire hospital system for her expertise and her judgment. Patricia's transfer was finalized, and she left Metropolitan General Hospital after a brief transition period. She didn't apologize. She didn't explain herself. She simply accepted the reality that she had lost her position of authority through her own poor judgment and her own bullying tactics. The administration made it clear that they would not be giving her a positive reference, that her actions would be documented in her personnel file, that her conduct had violated hospital policies on professional behavior and personnel management. Other hospitals would eventually hire her, but never again in a position of absolute authority. Never again would she have the kind of unchecked power that had allowed her to eliminate threats without consequence. Sarah's life off the clock changed too. She started accepting invitations to hospital social events. She went out for coffee with other nurses. She spoke openly about her background when people asked, sharing stories about her time in the military in ways that were honest without being traumatic. She joined a support group for veterans transitioning to civilian work, and she found community there with people who understood the specific challenges of leaving the military and trying to build a new life in a place where violence wasn't a daily reality. She still covered some of her tattoos sometimes, not because she was hiding, but because she was choosing. Some things were private. Some things belonged only to her and the people who'd been there with her. But her arms, her visible tattoos, the marks of her service and her losses, those she wore openly now as part of her identity. They told a story. They told people who she was and what she'd done and what she valued. They were marks of honor, not marks of shame. The hospital eventually established a new position, a senior trauma consultant position, and they offered it to Sarah. It would involve working trauma cases, training residents, advising on complex medical situations, and helping to establish protocols for managing high-acuity patients. It was a recognition of her expertise and her value to the institution. She accepted it because it allowed her to do what she was meant to do, what she had been trained to do, what called to something fundamental in her. The day she officially took on the new role, the entire trauma department came to the office to celebrate. The physicians brought coffee. The nurses brought pastries. The surgical team presented her with a customized stethoscope engraved with her military call sign. Colonel Webb came to the hospital for the occasion, standing in the background with pride written across his face. He understood what this moment meant, that Sarah had finally stopped running from who she was, that she had finally accepted that her military service and her civilian nursing career didn't have to be separate things, that she could be whole and integrated and powerful because she was accepting all of herself. She had belonged in the trauma department all along. Sometimes it just takes a crisis and a special forces commander to make everyone else see what had always been true. But the most important part wasn't other people seeing it. The most important part was Sarah finally seeing it herself. She was an exceptional medical professional. She was a decorated military officer. She was a skilled trauma nurse. She was someone who had faced violence and loss and had chosen to transform that experience into the ability to save other people's lives. She was all of these things at the same time, and they didn't cancel each other out. They made her who she was, and who she was exactly who the trauma department had needed all along. Someone who belonged. Someone who was willing to run toward danger to save other people. Someone who had been tested by fire and had come out the other side stronger, more capable, more human than she'd ever been before. The lesson in her story wasn't complicated. It was that hiding yourself never saves you. Pretending to be less than you are never protects you. The people who feel threatened by your competence will attack you anyway, just with the added insult that they're attacking a false version of you. The only path forward was integration, acceptance, bringing all of yourself into the light and standing firm in the knowledge that you were worthy, that your experience mattered, that what you had survived and what you had learned through that survival was valuable and real and could help people. Sarah would continue to heal from her trauma. The work with her therapist would continue. The nightmares would probably never completely go away. The hypervigilance would probably always be part of her nervous system. The weight of her losses would never be light. But she didn't have to carry it alone anymore, in the dark, hidden beneath sleeves and false humility. She could carry it openly. She could let it inform her work. She could use what she had learned in the hardest places to save lives in places where healing was actually possible. She had been broken by what she'd experienced, but she hadn't been broken in a way that made her less valuable. She had been broken in a way that revealed her strength. The kind of strength that comes from surviving and choosing to keep going. The kind of strength that comes from facing the worst things humans can do to each other and deciding to respond not with violence, but with healing. The kind of strength that comes from integrating trauma instead of running from it. That Tuesday that started like any other morning had changed everything. Not because Patricia lost her position or because Sarah got her transfer approved. Those things mattered, but they weren't the real change. The real change was that Sarah had finally stopped choosing invisibility. She had finally chosen herself. And in choosing herself, she had become the person she was always meant to be. Someone who ran toward the crisis. Someone who knew what to do. Someone who belonged in the trauma bay, not as someone trying to hide, but as someone who stood in her full power and said simply, "I'm ready. What do you need?"